Every story is founded on that. Every change is founded on that. It's just that we often overlook it. We look straight over the top of these small changes because we're looking for something bigger. And we miss the opportunity to harness this small change because we just don't have the right focus. It's like we walk around constantly with a pair of binoculars strapped to our faces when in fact we ought to be swapping binoculars for sometimes a microscope, sometimes reading glasses, sometimes computer glasses. We really need to be able to adjust our focal point from infinity pretty much back to right here to be able to appreciate the different magnitudes of change that can be experienced. And I would even go as far as to say, if you've overlooked a small change, then you've overlooked an opportunity for something to be different. That's key. Second is to move right away from the idea of success and failure and instead frame things up as progress and learning. That's not word artistry. That's not just trying to avoid something. I think that's a helpful framework. Progress and learning. How much progress am I making towards where I say I want to be, and what am I learning along the way?
Hi, Po.
What's up, Rak?
How are you doing, my friend?
I'm good. Good.
It's always good to see you. So today we're going to be sharing our conversation with Simon Matthews. I think you remember Simon.
Yes, I do.
And Simon is a health coach. I think goes well in the long line now of wonderful conversations we've been having with health coaches. And today's certainly doesn't disappoint. Po, change is something we all struggle with, right? Making changes to our health behaviors. Am I right?
100%. I'm really interested in the steps on how to make changes because it can be tough to make changes.
That's right. I mean, this whole world of, and that's why we are often having health coaches, health and wellness coaches on, is because even having 100% knowing exactly what you should be doing, there's so many of us that have the knowledge and have a hard time following through with the actions.
Yeah, 100%. I agree with that.
Yeah. So Simon is I would say, a trailblazer in the world of health and wellness coaching. I got to meet him, how I meet many people, through the American College of Lifestyle Medicine. He actually gave a talk last year in 2022 all about how to ask the best questions in coaching sessions. And really, he made the point that, conversation you have with a coach is really where change happens. And the way that change happens is by causing the individual to really question and then develop insight into the changes that they want to make and why it's important for them to make those changes. That talk was really incredible. He actually did some live coaching on stage with an individual, and we saw some transformation right before our eyes. Simon, then I went up right after that to meet him because why not? Simon's credentials are as impressive as his expertise. He is now a newly appointed fellow of the American College of Lifestyle Medicine, as well as a fellow of the Australasian Society of Lifestyle Medicine. He's board certified in health coaching and lifestyle medicine. His role as a professional certified coach with the International Coach Federation, and he has a faculty position with Well Coaches School of Coaching. These all highlight his commitment to excellence in this field. And so beyond coaching, Simon contributes significantly to healthcare leadership. He serves as the director of the Global Positive Health Institute in the United States and the Practice Excellence Institute in Australia. His work with these organizations focuses on how we integrate lifestyle medicine and positive psychology into healthcare to improve quality. In our conversation today, Po, we delve into Simon's unique approach to health coaching, emphasizing the power of questions and effective communication. We also explore his innovative ideas in blending psychology and lifestyle medicine to foster better health and leadership. Simon's international consulting work in health coaching, behavior change, social connection, and lifestyle medicine offer a wealth of knowledge and experience. And when not immersed in his professional pursuits, Simon enjoys his passions of foreign languages, specifically French and Spanish, and a love for plant-based cooking. So join me and all our listeners, Po as we engage in a thought-provoking discussion with Simon Matthews, who I'd say is a visionary in health coaching and a leader in integrating psychological principles into healthcare. So if you are winding down your day, maybe you're going for a walk, maybe you're on your commute home, this episode is a must listen for anyone interested in the transformative power of health coaching and the future of healthcare leadership. Let's do the show. Welcome, Simon, to the Health Feast. It's such an amazing pleasure to have you here finally after getting to know you over the last year. It's been about a year since we met.
Yeah,
right?
a year and a little bit. Yeah.
And Simon and Po meet each other. You guys just had a chance to meet.
Yeah, I'm looking forward to this conversation. I really am.
That's right. I was telling Po earlier, and maybe I'll just tell our listeners how I had a chance to first meet you. So Simon and I are both, as we've already told them all, although I want you to sort of get into the many letters after your name. That's a lot. There's a lot. There are a lot there. As I was talking to Po, I was like, whoa, there's 7. Like, you just added one too. Like, you didn't have enough. But no, I was at the American College of Lifestyle Medicine annual conference, which is like our Christmas in November, as we like to. And I went to a session that you gave, Simon, which is all about, I don't remember the title exactly now, but it was all about asking the right question and how really crafting the question can in itself unlock this hidden potential from the conversation.
Yeah.
No pressure on us, though.
I'm watching.
Yeah. So, and you had this method called the question cube, which maybe you'll talk about later. I was telling Po, I was like, then there was an audience member, and Simon, I know, I just fell in love with you after this. Like, you bravely came up and you did live coaching with him. And it was just amazing how you created a space of vulnerability for this gentleman and in front of like hundreds of people. And then the insights that he sort of took away and that came out from you sort of demonstrating these techniques you had just talked through was really cool. It was really cool. So I went up to him right away. I was like, who is this guy? I have to meet this guy. I even said, you said you were going to be in the Bay Area. I was like, let's meet up. And then that never happened. But here we are now meeting up. I saw you then recently at the Lifestyle Medicine Conference, and top of mind was, Simon, I started a podcast now. I'd love to have you on. And so here you are. And
it's a great pleasure.
I want to sort of have you, we always have our guests sort of reflect on their origin story. And how did you come to a place where you were giving talks about asking the right question, which is not, that is not a career choice that people, when they're a kid, they're like, I'm going to be helping people figure out how to ask good questions.
Indeed. Well, I've had a fairly long and winding path here. In fact, it's probably one of the more circuitous paths into this sort of work. But when I first left school many years ago, I went straight to university and I studied French at university, French language. And in fact, I graduated from university with a degree in French and had absolutely no idea what to do then. And my great love at that time was radio broadcasting, and the university that I went to had a broadcast station, a community broadcast station. So I started volunteering there, and then, over time that led to some on-air work, voluntary. It then led to some paid on-air work. I used to stand in for the breakfast announcer at the radio station, and that sort of really fired up my passion for radio, and I went off to film, TV and radio school with the intention of becoming a radio broadcaster. I don't know whether I was a petulant youth or there really was something radio broadcasting in that arena that I didn't like, but I didn't like it when I went to school. I just didn't like radio broadcasting. So I stepped away from that, but I had a friend who was working with young people in out-of-home care, so adolescents, sort of 12 to 18, out-of-home care. And I started doing some voluntary work there. Along the way, I met a family therapist who was working with these young people and their families as well. I got curious about what he did and he explained it to me. I asked if I could sit in on one of his sessions one day with the family. So he sought their permission and I did that. Well, I fell in love in that moment with family therapy, with the systems thinking behind family therapy, And I fairly quickly went off and studied family therapy and found a similar position working with young people and their families. That interest in family therapy and systemic family therapy led to an interest more generally in therapy. That led me to train as a psychologist. So this is about 10 years after I finished my French degree. I went back to school and became a psychologist. Once I was a psychologist, I started doing employee assistance program work. I was working with military veterans, working with first responders. I did a lot of insurance work for some time. And I used to, of course, do all the usual work that psychologists do. When I say usual work, I mean working with people presenting with indicators of depression and anxiety, so on. And somewhere in there, around the mid-early 2000s, I started getting a little bored, I think, and I very nearly became an airline pilot. So I was already a pilot, already had a license, a commercial license, instrument rating, multi-engine. I'd done my air transport pilot's license theory subjects, the big exams, a bit like the lifestyle medicine exam, the big exams that you do to become an airline pilot. So I started recruiting for one of the Australian airlines. Then the global financial crisis struck in 2007. So I was already 40 years old by then, and hiring stopped. So I went back to, being a psychologist. But now I was starting to read about the impact of things like diet and exercise on mood. And I started asking myself, why am I sitting, actually in this very office I'm sitting in right now, why am I sitting in this office just talking to people when I could be doing all this other stuff that's making a difference as well? So I trained as a fitness trainer, a personal trainer, and started folding that into the work that I do. And that's really what then tumbled me into lifestyle medicine. Shortly after that, I joined the newly organised Australasian Society of Lifestyle Medicine. A few years after that, I started going to the American College of Lifestyle Medicine conferences and became a member of the American College. That led to, ultimately to fellowships in both the Australasian Society and just this past month, the American College of Lifestyle Medicine. And finally, at the age of however old I was then, I feel like I found the thing that I'm really passionate about. And what I particularly love in lifestyle medicine is, first of all, how to empower behavioural change. Because without behavioural change, lifestyle medicine is a collection of very valuable pieces of information, but it remains that. It remains information. If we don't have a way of converting ideas about what to eat, how to exercise, the sleep you should get, the social connections, if we can't support patients and clients to convert that into changes in their life, then it's like the coolest car in the world sitting in the showroom undriven. So behavioural change is one thing, and then as one of the elements, lifestyle medicine, social connection and positive psychology is the other thing that I get really excited about. These days I don't do any therapy work. I do a lot of teaching, a lot of training, and my own coaching work really comes out of a particular interest I developed during the pandemic, when it became very clear that healthcare leaders and healthcare practitioners themselves were really under the pump. And it suddenly became crystal clear to me what a major systemic failure we would be facing if we took all our healthcare leaders and healthcare practitioners out of action in some way. So my coaching work these days is to support the health and wellbeing and the vision, the future, the imagination of healthcare leaders. So, like I said, a long and winding path.
Yeah, very long and winding. But Po, I want to hear your thoughts, but I also just I'm curious, like the radio world, you glossed over that and you said it just wasn't right for me. And was there something particular about the culture of it that just rubbed you the wrong way?
You must have gone to a session on asking great questions, Rob. That's a great question. Yeah, that pretty much nailed it. My love of radio is really a love of a means of telling stories. That's what I love about radio. And when I fell in love with radio, what I fell in love with was interviews with people where people's stories would gradually unfold, over the course of half an hour. You'd get insights into people. Those insights would prompt you to reflect on yourself and your own life and how you think about some of those things. When I went to school to study radio broadcasting, a very large part of the radio broadcasting that we do in a commercial context, the primary job of a radio broadcast, of course, is to sell advertising. All those nice songs you listen to, they're just the vehicle to get you ready to listen to an advertisement for something. So it was a kind of a culture shock. At the same time, really disappointing. I remember being profoundly disappointed at the time that, this is actually the world that I, thought I wanted to get into. So I backed out of there. Yeah, exactly right. Or the part of radio that I really love still exists, of course. It just tends not to exist in that part of radio broadcasting. Yeah. So yeah.
Wow. So I was just listening and I'm thinking, man, it's interesting how you went, you pursued one thing and then you're like, all right, I realize how you got the clarity, like, all right, this is not for me. And then you somehow found the next avenue of something that you were interested in and then studied that. And then now we're here. Now, and my question was, what have you learned?
Oh, yeah.
I mean, you're talking about, like behavioral changes and then even reflecting on your own life to even discover lifestyle medicine. Like it kind of took you down this like rabbit hole of things that you kind of discovered. And then, but I really wanted to know, like, what have you found in your practicing and like when you're helping people with changing their behaviors? Is there like a common thread of something that always happens that you've learned about coaching people?
Now, Po, I know you didn't go to a session on asking great questions, so you must have been talking to a guy who went to a session on asking great questions. So it's a fantastic question, and there are two things. From where I stand now in my life and kind of looking back over that arc of time, there are two things that I would say I've learned for me, and also the valuable ideas that I keep in mind in working with people around behavioural change, and of course teaching behavioural change as well. The first of those is that there are multiple kind of right answers here. Like there are so many ways you can make your way through a life meaningfully. And I think sometimes we get invested in the idea that this is the pathway I must follow. This is the thing I must do. This is the only way to navigate through this. Sometimes we even do that, when we, if we're faced with a problem or a challenge that we need to navigate through. Sometimes we kind of zoom in on a singular idea and treat that as if it's the only possible thing to do. So one learning is, this idea that lots and lots of pathways. And in fact, that idea is embedded in a tool that was designed by a couple of Stanford professors called the Odyssey Planning Tool. And it's a way of supporting people to identify in their own lives multiple kind of visions or possibilities for themselves rather than simply settling on a single idea. So that's one. The second idea that's now really clear to me, which has been a very valuable learning, is there is no wasted learning. There is no wasted learning in anything. So I now draw on ideas from radio broadcasting, my time working with young people, from hours that I've flown an aeroplane, from all the ancillary kind of activities associated with flying, like navigation and weather, things like that. All of those things now form part of the basis of my thinking, the examples I use, the metaphors that I describe, and so on. So, yeah.
Wow, man. That's awesome. I just wanted to kind of go off of some of what you're just describing, because for me, and I know me and Rak have spoke about this, a career path that I chose in the past, I'm now in this path, in this career. And I glamorized it too prior to getting into it. And now that I'm here, I'm like, man, I don't know if I want to do this. I don't see myself doing this for a long time, And then to go to your second point of all the different, careers or different jobs that I've had in the past, I've kind of created who I am today, and what I foresee myself doing in the future. But that leads me to my next question is, how do you, let's say you're teaching, even when you're teaching, but let's say you're helping somebody, coaching them through their own lives or their companies or their practices, when a person keeps, and it kind of goes back to your point about you're learning all the time, how do you coach from failure after failure? You know what I mean? Let's just say like for me, I've practiced lifestyle medicine in that I went completely plant-based, but I find that it's a struggle, to continue the lifestyle. And like you were saying earlier about just being information, after you said that, I started reflecting on myself and I'm thinking, man, it is I know the information. I know, how bad it is to consume the meat or, I know that, but I still am drawn to, eating meat products. So I was just going to say, like, how do you coach people when it's, they're struggling in
Yeah.
certain things,
Yeah.
whether that's the,
Yeah.
yeah.
So to illustrate what we've just been talking about, one of the primary ideas here actually comes from systems thinking, which was the exposure that I had, 30 years ago, that in many ways kind of, sits behind what I'm doing now. And one of the principal ideas that's embedded in systems thinking is the idea of small change being sufficient. A small change is sufficient. And this is a little counterintuitive because sometimes, and this is true, I think, for all of us, sometimes when faced with, a particular issue that we want to deal with or need to deal with in our lives, or a challenge that we're facing, we make this one-to-one correspondence in our minds with the magnitude of, or the perceived magnitude of the problem, and what we think is the magnitude of the solution. So if we perceive it as a big problem, we feel like we need a massive solution to be able to deal with that. And that, of course, leads to what I call kind of boom and bust thinking. So the boom thinking is, man, I'm all in, I'm going to go 100%. I'm going to run 5 miles every day. I'm going to spend 2 hours at the gym every day. I'm not going to touch a single ounce of meat ever again in my whole life. I'm only going to eat broccoli, breakfast, lunch, and dinner, all these sorts of really extreme ideas, which of course are unsustainable. And so pretty soon after, we bust. And what accompanies that bust is feelings of shame and humiliation and failure, which kind of simmer and fester for a while, often holding us back from small things that we could be doing. And then sooner or later, all of that builds to a point where we say to ourselves, that's it, today's the day I change, and then we're back into it again. So you're caught in that boom and bust cycle. So one of the ideas from systems thinking is the small change idea, which I embed in everything that I do, and that can be embedded in questions as well that you might ask someone. So for example, if I asked you to share with me a story of one tiny change that you made in your health journey that's now making a big difference to you, what comes to mind? There's one way of doing it. If I was, catching up with someone, week on week, I might just ask routinely, what's one small thing that you've noticed has been different in this last week? So I'm directing my clients' thinking and focus towards small change in those questions. That's key. Second is to move right away from the idea of success and failure and instead frame things up as progress and learning. That's not word artistry. That's not just trying to, avoid something. I think that's a helpful framework. Progress and learning. How much progress am I making towards where I say I want to be? And what am I learning along the way? I mean, you guys started asking the same sorts of questions to me straight up. So progress and learning is the frame that I introduce and encourage people to think about. And the third one is recognizing the strong emotions of shame and humiliation that often accompany such experiences. And so making sure that I'm doing things that don't inadvertently cast a judgment on someone. So, being careful with language so that, displaying curiosity and interest in that person's experience, regardless of what it is, even if they feel ashamed or humiliated by a perceived failure, taking the time to understand what's behind that. How did you arrive at that? And one of my favorite questions, what else are you feeling? This is a really key idea in behavioral change. I think, again, we, a lot of the time, if I ask you, how you're feeling right now, each of you might tell me one word, or happy or content, or, something like, or maybe not. Maybe you're feeling aggravated at having to have this conversation. Whatever it is, you'll say one word. We often treat that as entirely descriptive of your experience, just that one word, which of course, the moment you say that, you realize how ridiculous it is. A single word to describe an affective state or an emotion cannot possibly encompass everything we feel. So what else? What else are you feeling? And what else? And what else? And that helps someone build out, I think, a clearer picture, a more complex and nuanced picture, and allows them still to acknowledge that there's a sense of humiliation or shame there, but it's sitting in a much broader context, and it's not the only thing that's there. There are other things that can be taken hold of as well.
Wow, man. I really can relate to that. And I think that also helps when you're in the process of coaching people, that you got to kind of be kind of intuitive in that sense. When you're talking to people, your listening has to be laser focused, and you kind of have to like read people when you're in the midst of helping them and coaching them. Because when you're talking about listening, I kind of relate it back to our, in the system with doctors nowadays. It's like they're not very, they will more likely accept the one word answer than actually thinking about like, well, like what you were saying, well, what else, how else are you feeling? Like I don't get that when I go to a doctor's visit. It's more like more precise, and you tell them good or you tell them bad, and then they kind of, so I feel like are listening actively, and you're also kind of being, I don't know if the word is empathetic, sympathetic, when you're talking to the, patient or something, it kind of just, it works on the relationship versus doctor versus patient relationship.
Yeah.
It's more like
Yeah.
kind of focusing on.
One of my favorite words, I think it's a word that reasonably accurately describes what we're talking about here, is the word curiosity. And that's often what's absent from engagements. And an absence of curiosity, of course, often comes with the territory for professionals. When we go to school to study to become something, psychologist, like I am, or dietitian or physician, whatever it might be, engineer. I have two adult sons who are engineers and work in that area. What do we learn at school? Well, we learn knowledge. And what are we told about that? Well, we're told that our value as a professional comes from that knowledge, having that knowledge and applying that knowledge. And if you sink too far into that, or if you don't balance it well, you lose the idea of curiosity, and you become invested in this idea that I have all this knowledge and my job is to use this knowledge to fix something. And we're in that kind of, I'm going to call it a push mindset. I need to take this and push this knowledge into the situation. Then we're no longer in a pull mindset where we're curious about pulling more information towards us. So oftentimes the very nature of the training that we do and the structure of that can lead us to lose our connection with, at least temporarily, curiosity. The good news is you can get it back, of course. It's not difficult to regain a sense of curiosity, but I think that it can be a casualty of the way that we think and the way that we train people.
Yeah, Simon, you're describing like who has the authority in those relationships. And like in the traditional sense, like the doctor-patient relationship, the doctor has the authority. They're the ones who know the right answer or what you should do. And in the model where you're, as you said, pulling, like you're really pulling out, what is that solution? Because I don't know that. You're the one who knows that. How could I know that? I'm not you.
Yeah.
It's so different.
Absolutely. And it's also often, frequently, maybe almost always, unexamined and unnoted. So we don't have conversations in healthcare about this idea of authority or an authority gradient or who has the power in this relationship. It doesn't form part of the landscape of conversation that we have. And as a consequence, it remains entirely unexamined and doesn't often have an opportunity to be addressed or done differently. It's only when we decide that we're going to name it and focus on this idea that we have that opportunity then to start doing something different.
I was just thinking about, you said that you also worked with like military and first responders. Could you talk a little bit more about that experience? Like, was it more for like therapy, or is that?
Yeah, the work with military veterans was therapy, and similar with first responders, although I did do some workers' compensation insurance related work with first responders as well. I used to meet with them, undertake, a clinical assessment interview, prepare a report for the insurer that might detail a particular incident, event, or set of events that this first responder had been exposed to that had led to some sort of psychological or even a moral, if you like, a moral injury of some sort. But largely that work was therapy work, and of course, sadly, largely focused in exactly the area which you might expect, which is trauma and traumatic exposure. So for military veterans, most of the military veterans that I saw when I did that work were, interestingly, much older and from the Vietnam war, and I'll tell you a particular story about that in a moment. Some of them were from the first Gulf War, and some of them from some more recent military deployments that Australia has had overseas. First responders, were all varieties of that: firefighters, paramedics, police officers. Again, typically therapy provided in the face of a traumatic exposure or a series of traumatic exposures, which could be a terrible fatal accident, car accident, could be a shooting, an assault, all sorts of things that might lead to that. That, for me, that work had a limited life. I did it to the very best of my ability, and also over time recognised that my constant exposure to other people's trauma, at least for me, was not something that I wanted to sustain for my whole life. So, gradually moving away from that. I've never completely left it, though. And he's not a client anymore. We don't have that sort of relationship. But there's a gentleman that I'm still connected with who's now 73 years old. And he was in the Australian Army, deployed to Vietnam in 1969-70, I think. And when I finished up this work several years ago, I said to him, I'm going to finish this work in the next few months. And I'd already been working with him, and to some extent him and his wife, for a long time. During that course of time, which partially intersected with my transition into lifestyle medicine, during that period of time, he started exercising more. He started modifying his diet in places. He started being much more purposeful about the social connections that he was building. And having been using prescribed from his psychiatrist for literally decades, he gradually tapered off that medication over a number of years. Wow. Now, I will say here that everyone's mileage varies here. That's his story, and there's no great goal here to sort of get people off medication. However, that was his experience. He's now made a lot of progress. We still keep in touch. He rings me periodically. In fact, he rang me just after I got back from Denver, Rock, and the conversation was really just, hi, I'm up here, on the far north coast of Australia. I'm out fishing with some friends. We've gone on a fishing trip. Just wanted to catch up and say hello. So that's one of the sweet stories of my professional life, to have that connection that transitioned away from the professional therapeutic relationship we have. Not to a friend, I wouldn't describe it as a friendship, but it's just an enduring connection in which I periodically contact him and say, how's everything going? And he periodically contacts me and says, I'm having a good time.
Right.
He's become a friend, it sounds like.
Kind of, yeah. Not someone I'd go out for a beer with, but,
Sure, but someone you regard.
Exactly right. And I do hold him in high
beautiful.
regard. I hold him in
That's
very
right.
high regard, yeah.
But it's beautiful. It speaks to the power of relationships in the work that you do. And something Po and I talk about all the time is that, to have a healthcare system focused on relationships and not, focused on diagnosis and management, which is what we have right now. And then if you focus on relationships, actually the health outcomes get better. Yeah. Anyway, I wanted to circle back to, you talked about radio and you talked about storytelling and stories and how powerful stories are. And that really resonates. Obviously, I mean, this is why we do this show, is because, there's this power to hearing and sharing stories. And then, as you said, like in that telling, the insights that come out and the kind of the lessons that other people can learn. Ideally, you learn from experience. And I mean, what is that? I heard this idea. You learn from experience. Ideally, it's not all your own.
Yeah.
And so one of the things you started, I think a couple of years ago, is this Tiny Health Stories, which you told me about in Denver at the Lifestyle Medicine Conference. I thought maybe you could just share a little bit about that initiative too, because I think it's a really cool idea. I was telling people about it before we started.
And you're absolutely right. Stories are very powerful vehicles for change. They're very powerful vehicles for insight, for being able to reflect. They're powerful vehicles which carry elements of attitude, elements of belief, elements of morality, value, and so on for all of us. And interestingly, there's not anything necessarily universal about them. Although, so if we were to tell a particular story right now, if we were to perhaps a parable from the Bible, or if we were to tell a children's kind of fairy tale, the majority, and then we ask people, so what did you take away from that? A lot of people would probably cluster around a particular idea. This is what really stood out to me. And then there would be some variety in there. A different person would say, "Oh, I got this out of it," or "I got this out of it." So this is the power of story, that we can project onto it lots of things. So Tiny Health Stories really has two origins for me. The first is, again, back to those ideas that we talked about earlier in my introduction to systems thinking and the idea of small change. I've been in love with small change for more than 30 years, and the idea that you don't need necessarily to start with a big change to get a big effect. You can start with something very small and progressively leverage that until you get the desired effect that you want. The second inspiration was that I used to read quite routinely, and a little less so now, although I do still read it. I used to read a lovely column in the New York Times called Tiny Love Stories. And some of your listeners may be familiar with it. Tiny Love Stories is a delightful column. It's stories of love in any way that you care to conceive of that. It might be a story of passion, of love, of warmth, of friendship, of lust, of sadness, of grief around love. But it's a story of love told in 100 words, no more than 100 words. And I love reading those stories. It's like, they're like distillations of experience. This whole narrative gets distilled into just 100 words. And one day the thought just popped into my mind that we could do the same thing with stories about health. People love hearing stories about health journeys, partly I think because they're universal, a little like love. The experience of love is universal. The experience of engaging with health in its various ways is also universal. We all have stories to tell about good health, about health challenges, about recoveries, about threats to our health, and so on. And we love to engage with experience and be able to see an arc across that story, to see a sense of movement across that story, to see that, for example, someone might have begun here and ended here, or to see the possibility of change, or to see, what one of the themes I think that's often evident in stories is the theme of redemption. The idea that nothing is ever so bad that it cannot be redeemed. And when we experience that sense of redemption, and I would acknowledge, of course, that redemption is an idea that's embedded in a lot of faith practices and faith cultures, but it's an idea that extends beyond that as well. When we experience redemption, there's something extraordinary about that. And that's what people can take out of the stories. So I started this project, Tiny Health Stories. The intention is to simply gather stories of health journeys, of health challenges, anything to do with health at all, told in 100 words or less. And my intention is to, over time, create a trove of these stories that people can just dig into and dip in and out of, read something, take something away. About a year and a half ago, so I designed this idea, and it was kind of sitting there, not doing much. I'm also a director on the Global Positive Health Institute, and about a year and a half ago, I said to my dear friend and colleague Liana Lianov, what if I put Tiny Health Stories inside the Global Positive Health Institute, so it becomes in effect a project of the GPHI? And Liana was keen for that and very kindly agreed. So Tiny Health Stories now sits within the GPHI, and like I said, my goal is to keep building and growing these stories. Yours is the most recent addition to the list. Thank you for that. And hopefully some of your listeners, I'm sure we can put the link somewhere. And
we'll put the link for sure. I will say I wrote it, and what I wrote is what's written. But two things that really, I think, elevated it was one, the picture. So you have a picture which ties into my story really well, because I started meditating in my car, and you have someone shifting a gear. And the title, I don't think I came up with the title, A Shift, and then having someone shifting a gear in the car. And then also the formatting of it, like the spacing and having this line separate, and it's not necessarily how I would have formatted it, but when I looked at it and read it, I was like, oh, that's really effective. And then as I've been going through other stories, I noticed that there's a particular intention in how you're formatting it and the picture that you're using. So it's really cool. I just want to, any of our listeners, we'll put the link, and you share your story too.
Absolutely.
You can go on and
costs
I was
a few minutes of your
Poe.
time. That's all.
That's right. I was reading Poe, one of the stories, I think the one right before that from a couple months ago, Restored Health.
Oh yeah.
And is that and then he talks about making small changes. So it's interesting. Is that something you're seeing in a lot of people's stories, or when you've been working with clients, like the people who successfully make change in the long term, are they the ones that, if you look back, actually it started with something?
Absolutely. And I would even go as far as to say that every story is founded on that. Every change is founded on that. It's just that we often overlook it. We look straight over the top of these small changes because we're looking for something bigger, and we miss the opportunity to harness this small change because we just don't have the right focus. It's like we walk around constantly with a pair of binoculars, strapped to our faces, when in fact we ought to be swapping, binoculars for sometimes a microscope, sometimes reading glasses, sometimes computer glasses. We really need to be able to adjust our focal point from infinity pretty much back to right here, to be able to appreciate the different magnitudes of change that can be experienced. And I would even go as far as to say, if you've overlooked a small change, then you've overlooked an opportunity for something to be different.
Why do you think that is? Why do you think part of like being human is that we tend to put the binoculars on versus... why? I mean, I'm thinking, that's very true. I can totally see that. I've done that in my own life, set a big goal, lose 100 pounds, and then like when we lose at 1 pound, it's like, it's not good enough.
Come on, what's wrong with you?
10 pounds. Right. Like, what have you learned, like in just dealing with people? And because I completely agree with what you're saying. I think I got to start changing my mindset to that. Like, it's not that it goes back to, it's not that I'm not aware of it. It's just like you said, you kind of overlook it sometimes. It's almost like you kind of get back to the basics.
It's a fascinating question, isn't it, about what's behind our tendency to do that? There's a few things, I think, as with anything, there's never a single explanation for anything, but there's a few factors that I think make part of it. The first is perhaps that belief that when we have a big problem or a big challenge, we need a big solution. And I think that type of thinking is probably reasonably common. We need to apply a big solution to those problems. And while at some level that might be true, we don't necessarily need to start at the big solution level. You can ramp up to it, as it were. What else might be behind that? I think sometimes the idea of urgency plays a role in this as well. So we place upon ourselves pressure, possibly an artificial pressure, around the urgency of change. And that means that we create chunks of change that are much bigger than they need to be. So, for example, let's imagine someone who's 100 pounds overweight and needs to lose that. Well, yes, it's going to be desirable to lose that weight. Do they need to lose 100 pounds in a month? Well, probably not. What about 2 months? Probably not. The more important element is probably that they get onto a pathway of steadily losing the weight. And it might, maybe it's going to take 12 months, maybe it's going to take 18 months to lose that 100 pounds. And if you think about it in that way, if you remove that internalized, urgency or pressure to make this immediate, then it recasts the whole pathway and means that the smaller changes are the ones that become much more effective. One of my favorite metaphors to use here is the metaphor of a journey. And in fact, I've actually had clients stand up in my office and illustrate this for themselves. In fact, I could do it with you right now. Which way are you facing? Way are you facing, Poe? Like north, south, east, or west?
West.
You're facing west. Okay.
West.
So I want you to just stand up where you are.
Okay.
All right. Okay. And take a step back.
Okay.
Are you closer to the Pacific Ocean now?
No.
Well, I'm going to respectfully disagree with you. You told me you were facing west. You've taken a step towards the east. You're a little bit closer to the Pacific Ocean. Take another step.
Step back or step forward?
Well, if you're facing west. Okay, sorry. That's my bad. You've taken a step towards New York. Yeah.
Exactly.
But you are now closer to New York.
Right. So Atlantic Ocean
Atlantic
versus
versus
Pacific
Pacific.
Ocean. So I see.
Yeah. So you're a bit closer to New York, and if you step forward again, now you and I are a little bit closer than we were, 30 seconds ago. So we often overlook these small changes and don't recognise that even that single step, while it doesn't feel significant, has started to take you in the direction that you want to go.
Gotcha.
Yeah.
What's coming to mind is momentum and trajectory.
Yeah.
Right. So you're building momentum, but also like it's intentional momentum. I mean, it's intentional change. These are small changes, but they're intentional because it's not that you don't have goals or bigger aspirations or things that you might do, like lose 100 pounds. It's just that those things aren't going to happen without starting small.
Yeah.
Now, do people's past, there's a lot of things to factor into this, but since we're talking about it, do you find that a lot of people individually that may have past issues with this type thing, do you see that as being something too?
Yeah,
Challenge?
absolutely. And in a couple of different ways. So the regular and I'll call it the regular and routine way that we're all exposed to, I think, is simply those past experiences. And as a result, the attitudes and beliefs that have started to cement as part of those past experiences. This is what happens to all of us. It's been embedded in all of our discussion. I've shared with you the origins to the work that I do. I now have a belief that systems thinking is really important here. I haven't actually come out and said exactly that, but that's embedded in everything that I'm saying. This really firm belief that systems thinking is important. Now, I might be wrong about that. Maybe I'm misconstruing. Maybe that's not the thing. Nevertheless, it's a belief that I now carry with me. We all do that as a result of our life experiences. We carry beliefs and attitudes. Those beliefs and attitudes, of course, in turn, then shape actions that we might choose to engage in, things that we might choose to say, and so on. So in that way, all of our past experience kind of loads on the choices that we make right now through that mechanism of embedded beliefs and attitudes. The other thing that we're becoming a lot more aware of, and when I say we, I'm talking about professionally, not just psychologists and social workers, but other practitioners as well. We're becoming a lot more aware of the impact of past traumatic experience and indeed perceived traumatic experience. So some things seem to be objectively traumatic. If you're a war zone and you're witnessing terrible things going on there, that's objectively traumatic, or I think it is anyway. There are other experiences that we can have, though, something that I might not find traumatic, but you do, or you might not, but I. And all of those traumatic experiences can become, I think, to some extent, distractions for us. They occupy a lot of our mental space, that they limit our capacity to devote cognition and attention to other things. They can inculcate in us a sense of fear about change. We can become quite attached to what is right now because it feels secure. We don't want to let go of it. And so being aware of trauma and being able to respond effectively to trauma, and there's a lot of work now being published in the area of trauma-informed care. There's a body of work building on trauma-informed coaching. And I think having that awareness that whoever is standing before us at whatever time they're standing before us is a person who brings with them an extraordinary story of their own, of, sometimes distress, success, challenge, grief, loss, triumph, all of those things wrapped into one.
That's interesting. I'm sorry. I'm totally getting into this. You're kind of leading me down these thoughts. I was going to ask you another question about addiction. With behavior, you're also someone who's talking about changing. When someone's, let's say, addicted to, let's say, is an alcoholic, or let's say, some type of pill or something like that. How does behavioral change? How do you help people that are maybe particularly addicted to a certain type of substance or actions sometimes?
Yeah, it's a great question. And I will say addiction's not an area in which I practice a great deal, and it's a body of professional knowledge that I have some familiarity with, but it's not an area that I practice in. But I will say that one of the challenges of addiction, of course, is that the behavior is often reinforced through extraordinarily potent reward pathways in our brains. We get a physiological reward for engaging in that behavior, which makes it extra challenging to step away from. And it's perhaps one of the ways that we might distinguish between a habit and addiction. Although even habits can bring some sort of reward as well. We talk about the runner's high. I'm sure that's a phrase that you're familiar with. The idea of the endorphin rush, supposedly, that you get when you exercise hard. If I've just run for half an hour or 40 minutes, or if I've engaged in my all-time favorite fitness activity, which is boxing, if I've done an hour of boxing, man, that carries me for the whole day. I feel so good. Is that an addiction? I don't know. So I certainly get rewarded for it, but I could also, if I went without it for a few days, I'd kind of manage as well. So I think addictions are very tricky because there are these complex reward pathways. There's the complexity, what we call a withdrawal effect when you're not engaged in that activity or behavior or action. There's the really strong, negative, almost punishing kind of experiences that come with that. And all of those things together combine to make a really powerful impetus to stay engaged in that behaviour. I think addictions is an area. I mean, personally, if I was working with someone, I could certainly support someone to identify, some different possibilities, some other things that might be possible here, some different things that they could be doing. But even as a psychologist, I've not done sufficient work around addictions to feel confident in treating someone who's dealing with that, and I would be inclined to work cooperatively with a colleague that I trust who works in that area.
Simon, I wanted to ask you to comment a little bit about the healthcare system, also the healthcare system in Australia, because I think probably a lot of our listeners are here in the United States, although we do have listeners all over the world. Thank you. And maybe some more now we'll have in Australia. So welcome to Healthy listeners. But I'd love if you tell us a little bit about the healthcare system in Australia. I don't know if it's as much of a mess as it is in the United States, and how the payment structure works there. And then also, like, your work in particular on changing healthcare system. Like, what is that visionary healthcare system that you're trying to create both there and here and everywhere?
Great question. I think probably the place to start is the place that everyone's, I think, reasonably familiar with, and that is that Australia, for nearly 5 decades now, has had a system of universal healthcare, which confusingly out here is called Medicare. So, if you're in the US, of course, Medicare means something completely different. But out here, Medicare is the universal healthcare system.
Well, you know what? It doesn't mean something different. It only means something different if you're below a certain age.
Okay.
But after 65, it means that you have universal coverage.
Yeah.
If you have certain medical conditions or you're over than 65, you get universal coverage. So we, as a society in the United States, like when these laws were passed, decided, we're only going to carve out universal coverage for this part of the population.
So universal here is universal. So it starts from infancy and goes all the way through to taking your final breath. And what that means is that conceptually, at least, primary healthcare consults covered by Medicare. Our healthcare system means that if you have appendicitis and need to have that surgery, you can go to a public hospital and have a surgeon conduct that surgery, and you'll essentially walk out of there charged for that service. If you get run over by a bus, if you fall off a cliff abseiling, all of those things similarly are covered. There is a bit of a shift here at the moment, and the shift is largely to do with the costs in delivery. So Australia, within that universal healthcare system, there's a principle called bulk billing. And bulk billing means that the physician is prepared to see the patient for only the federally mandated rebate and no co-payment. Some medical practices have always charged a co-payment. Some charge it in some circumstances, but not others. What we are seeing at the moment, I think, is an increase in those co-payments largely to do with economic factors around the cost of delivering service, the cost of physicians renting their premises, paying their staff, etc., etc. But that said, the bulk billing rate is still reasonably high here. And there are some terrific benefits to that system. There's some confusions as well. It's a chaotically complex system. There's federal government and state government involved. There's also an interplay with private health insurers. At some level, it's kind of a mess. No more a mess than you might find anywhere in the world, I think, with responsibilities shared across different arms of government in an effort to make healthcare available. But there are some terrific...
We have a bigger mess.
I mean, there are some terrific upsides to it.
What you're describing is a dream. Yeah, I was like...
Well... let me share with you a personal story. 4.5 years ago, I had a sudden spontaneous retinal detachment in my left eye. I wasn't bungee jumping or anything like that at the time. It was just spontaneous and happened. My wife and I were in the city, Sydney, this particular evening. It was a Friday evening. In fact, it was the 50th anniversary of the moon landing, 20th of July, 2019. And we were in the city near the Sydney Eye Hospital. So we went there and something weird's going on. I can't, it's just kind of black down here. And they looked in my eye and said, "Oh man, you got a retinal detachment. We've got to do surgery straight away." So I was admitted to hospital that night and I had surgery the next morning. And my surgery was conducted by someone who I think is probably the best ophthalmic surgeon in the country and probably one of the very best in the world. The man is a technical genius and extraordinarily compassionate all at once. Fast forward 6 months, so February 2020, same thing happened in my right eye, spontaneous retinal tear. Same surgeon did the same surgery. The really great news is I had a fantastic outcome. So he successfully reattached the retinas in both cases with no complications. I did have to have consequential cataract surgery. Rapid cataract formation is a consequence of retinal surgery. So now I've got bionic eyes as well, little intraocular lenses. My vision now, I mean, I'm wearing computer glasses now that just sharpen up the image here, but my vision now is better than it was 45 years ago. And all of that, so the hospital admissions, the surgeries, the post-operative care, the various consultations I've had over time, the out-of-pocket expense for me for all of that is somewhere in the order of $5,000, I would say, across 5 years, which is a minuscule out of exactly right for what actually went on. So there are some wonderful elements to healthcare provided in that way.
Well, so it's interesting that Australia has a universal system. It's government funded. So in that type of system, I would imagine, although maybe the experience is different, but I would imagine there is a financial incentive to reduce the amount of sick care and illness care that we're providing. And so do you feel like the system there has been receptive to lifestyle medicine as a sort of foundation of care? And I know you're involved in those efforts.
I think I think receptive is actually a really good word to use here, Rock. I think at an individual level and even at a practice level, lifestyle medicine approaches are held in positive regard, and there's a recognition, I think, of the power of lifestyle medicine. The challenge is, or the challenge as I see it, is that there's an entire juggernaut of a structure built around doing things a different way. And even though at an individual level, people can appreciate the value, and at an individual level, people, physicians, nurses, and so on, can bring those lifestyle medicine approaches into what they do. To see real system reform, I think we ultimately need something much more radical. And again, this goes back to systems and systems thinking. It's not difficult to conceptualize healthcare and healthcare delivery as a system with multiple parts. I mean, there's the government parts, there's the policy parts, there's the delivery parts, there's the patient elements, and so on. And all the parts of that system interact to produce, hopefully, healthcare outcomes. There was a very clear writer on systems thinking. She's passed away. Her name's Donella Meadows. Actually, I had a delightful conversation with Martin Tull from the American College of Lifestyle Medicine about this very paper while we were at the conference. Donella Meadows, about 20 years ago, a little more actually, wrote a wonderful paper on how to leverage points within any system. What are the leverage points within a system? And she articulated this series of 12 points of increasing effectiveness. So the simplest and most straightforward way to intervene in a system is really at the level of payments. So for example, if you were to offer physicians more to see patients, or if you were to offer patients a higher rebate for doing a certain thing, that's an intervention in the system, but it's a very kind of distant order, low-level intervention that doesn't bring about any significant change to the operation of the system. Ultimately, the most powerful means to change a system is to recognise the power to transcend the paradigms of that system, the elements on which that system is built, the way things are done, and to recognise that things can be done differently. And this, I think, in many ways is the promise of lifestyle medicine. Lifestyle medicine, if you really dig down into not only what it means for health, but what it means for how we practice healthcare delivery, lifestyle medicine is a paradigm transcending approach. And that brings both promise and opportunity, and it also brings great challenge as well, because being able to step outside a paradigm and think differently about how something could be done is extremely difficult when you're inside that paradigm to start with. Yet I think that's what's necessary here, a means of radically reconceptualizing how we do healthcare, how we do healthcare delivery, finding new systems, new structures, new processes, bit by bit. I'm going back to that idea of incremental change again, small change. Changing a whole juggernaut of a healthcare system is not something that happens, well, it certainly doesn't happen overnight. I don't think it even happens in a decade. I think those of us working in lifestyle medicine right now, people who at the end of our lives will be beginning to see some differences, and we're possibly going to be looking at another whole generation, maybe even two, to see some significant change. Now, some people might hear that and feel disheartened. I feel thrilled by that idea, that in my own small way, I can be making a contribution now. Exactly right. That although I'm not ever going to see the complete outworking of it, I know that I'll have done something that's made a difference. And that's, if you stop and think about it, that's true of everything. No one really ever gets to see in a single human lifetime the entire outworking of of a change that's been made or a change that's been begun.
Because it's constantly changing. Because it's constantly changing. There's going to be another. That's exactly,
and hopefully, paradigm. Hopefully, once we shift to a new paradigm, a new way of thinking, someone else will come along and say, we really need to transcend this paradigm. We really need to think differently about how we could do this and find a way of moving from there. And so this idea of constant change, of constant paradigm shift, is really valuable, and it's valuable at the individual level too. And I think that's a really nice point to emphasise here. That when we talk with people about behavioural change, and when we engage in say a coaching approach, a significant part of that, certainly in my practice, in my belief, needs to focus around how the paradigm of the person might change, or how to make it more subjective, how the person might shift their own paradigms, how they might move away from paradigms. When I mentioned before attitudes and beliefs, they're significant inputs into paradigms. The attitudes that we have about ourselves, about the world, the beliefs that we have about ourselves, about what's possible, about what we can do, they all form part of the paradigm that we form about ourselves and our lives. And so in behavioural change terms, if I ask you to do 10 push-ups, then that might be a change from what you're doing, but it's similar to that change I talked earlier of intervening at a really distal order in the system. And 10 push-ups makes a small difference right now. By this afternoon, it won't have made any difference. If I can work with you to understand the paradigm that you operate from, the beliefs you have, the attitudes that you have towards yourself, towards your health, towards being alive, what that means, what you want, and you can shift your paradigm about yourself in a helpful way, that then forms the foundation for doing a whole bunch of things completely differently in your life that may or may not include doing 10 push-ups each day. So the same broad kind of thinking can apply both at an individual level. And of course, we are systems as well. Individuals are systems. We don't often think of ourselves like that, but we are. We're an internal system. We're also part of micro systems, connected to our families and our friends. We're part of a meso system connected to our local community, our workplace, and so on. And we're also part of a macro system, which is that sort of much bigger, maybe national level system, if you like. So being able to think in that way and support people to examine themselves in that way and examine their own role in bigger systems as well, I think ultimately is the way that we make change.
I'm listening and I'm just like, because we've had conversations about this, how healthcare, our healthcare system, especially here in the United States, could change. But it's just, I've heard some people who are optimistic, and there are some people that are like, it's such a daunting task. It's just, I don't know if it's the same in Australia, but there's a lot of food companies that are driven by money, and I'm sure there's some level of that in Australia. But it's like, and then it's like this cycle that happens, and even the pharmaceutical companies, their interest in keeping people sick, and it's like. But you're right. I like what you were saying about how it might not happen in my lifetime. But I don't know. I don't have any kind of stat to just say this. But I think that people are more aware of health now. I don't know if it's like that maybe in the 80s but I feel like it's slow. It's not happening at a fast pace. But I just feel like more people are aware. Like I see so many. You scroll on social media. You see people in the gym. They're at least they might not be doing anything specific that would help anybody, but they're just there's more people talking about fitness than I think. And maybe because now there's social media. Now you can see, maybe it's always been around. I don't know, but I just feel like that there's definitely like a mass movement to people are more aware of fitness. Like people know that fast food's not good for you. Like that's in the 80s, nobody knew that fast food wasn't good for you. We just kind of did it. Coke, like soda pop and Cokes and like. We were drinking that when we were little kids running around. Like I had no idea. And then now, I'm in my 40s now. It's like, that's too much sugar, though.
Yeah.
I think, Simon, you said it earlier. You said it's not that there's a lack of awareness. I think so many things people now know. They know what they should and shouldn't be doing, generally speaking. They may not know like the specifics of what might optimize their health. But then the doing, that's where there's a gap. Like we're seeing health outcomes all over the world just continue to worsen, actually. So there's more knowledge and more awareness than there's ever been before. And there's this continual trend. And to Poe's point, it's, and Simon, like you're saying, this system doesn't just involve the healthcare system. It involves the food system. It involves all the politics around food subsidies. It involves so many things. It involves communities and safety in communities, access to food and community. It involves social determinants of health. And all these things are part of what determines whether or not like someone is likely to be healthy, I think, in an environment.
Yeah, absolutely. Absolutely. I like the use of the word likely that you just put in there. And I think, again, this represents, sometimes I think we approach these things, in a reasonably deterministic kind of way and say that if this plus that, then the other, we automatically get this output, and we don't. I think what happens is we increase the likelihood of a particular outcome. But as we were saying earlier, the system is chaotically complex. And in a chaotically complex system, it's very difficult to predict a specific outcome with a high degree of certainty. Yeah.
That's right. Okay. Poe, what do you think? I think we should ask our traditional question. You want to?
Yeah. So
dish it up.
So our, obviously our podcast is called The Health Feast. And one question that we usually ask everybody, as we finish up is, if we were going to invite you to a health feast, right? Like, and that could be a life philosophy, any kind of experiences or any kind of tip that you could give our listeners in your parting, what would you be bringing to the health feast?
So I'm going to be straight up honest here. As soon as I hear the word feast, I'm thinking food.
That's right.
Okay.
This is a proverbial health feast. Yeah. Bring food
So
and a mindset.
I think we can certainly use I love the metaphor, and we can absolutely take some ideas from an actual food feast to think about this. And
right.
what would I want to, the question itself is fascinating. What would I want to bring to that feast? And I guess that's the point, isn't it?
Yeah.
That feasts work best when everyone contributes something. When we all come with a spirit of sharing. So the things that I would bring up are, first of all, a mindset of bounty. There is so much. There is just so much. There is so much of everything available. Do we need more social connection? Turn on the tap. Do we need more love in the world? Just let it out. Do we need more conversation? Start talking. There's an absolute bounty of everything that we need for a health feast like this, a feast where we could share stories of overcome challenges, stories of success and progress, stories that are reminiscences, stories that are perhaps tinged with sadness. All of that is there in bounteous quantities. So I would first want to bring that mindset. And the second thing that I would want to bring to a health feast, I think, is the idea, one of those nice things that you sometimes get at the end of a feast, the little, are they called doggy bags in the US? I don't know, maybe terminology is different.
Yeah.
You go to a restaurant, you don't quite finish your meal, so they put it in a bag for you, and you can.
Oh, sure. Yeah, we call
doggy
it
bag. Yeah, okay.
Oh,
Yeah. So you can take it home. So one of the ideas that I would want to bring to a health feast is what doggy bags can be created during this time together. What are the things that we can enjoy being here, we can enjoy connecting, we can enjoy this interaction, and what can we take away from it, as a leftover, if you like, from that feast. And then, of course, my part would be, what can I do to contribute to that? What can I put into that? And, for me, I love questions, and I love hearing people's stories. That's how I would spend that time at that feast, hearing the stories, celebrating the stories, laughing with people, crying with people, but being fully present and fully immersed in the story of that person's life.
Wow. That's probably one of the best answers we've had, Rak.
It was so multi-tiered.
But you set another level now.
You set the bar.
Oh my God.
Well, and I love that you said that the best feasts are the ones where lots of people bring stuff. Yeah.
Simon, I just want to thank you for being here with us. I know today's conversation was mostly about you, but I'm sure Rak and I would like to have you come on, and maybe we can tell you our stories directly, and then you can help.
I want to talk to.
We can do because I feel like we want it. I mean, this is what we want. We want you to talk about you. We want to talk, find out your origin story. And I feel like maybe we should do another one when you have the time.
Absolutely.
Where you can
do it.
We can start talking to you about what we're up to, and maybe you can give us some coaching tips, or where you see that you can sort of help intervene and say, hey, this is where I'm hearing from you, and then make some suggestions. I'm open to that. Rak, what do you think?
Yeah, I think it's a great idea. I would love it.
Absolutely.
Simon, if you came back. Po, it sounds like you'd be up
very happy to do it
for doing a coaching session.
Yeah, okay. I was just, we were like, stand up.
Sometime in the new year. Yeah, we'll do that. Sometime in the next few months, new year, we'll get you back on. And Simon, if people want to learn more about the work you're doing, can people work with you directly?
They can. Like I said, my direct work these days is with healthcare leaders. But people can reach out to me for sure.
Okay. And we'll put all you have your LinkedIn profile and your website, and we'll link all that in the show notes. And we just have everyone do a fist bump into the camera. There we go. Boom.
He's a boxer.
Amazing conversation.
He's a boxer.
Yeah. Oh, that's a boxer. Yeah, that's right. That's right. Hour of boxing, and it gets you going. It gets you going.
Absolutely.
I love it.
Best thing ever.
Our listeners, thank you so much. And you can visit us at thehealthfeast.com, and you can submit a question for Po and me. And if anyone's interested in signing up for my newsletter, you can also sign up at our website. And we will see you back here next time at our Health Feast. Take care, everyone. Bye.